We need, of course, to thank all of the healthcare providers, nurses, doctors, professional health sciences professionals who would do the testing. All of them are putting themselves at risk, and they do so willingly and ably because that's what they do for a living. They bring care to people who need it, and we're very confident that where we are right now is as good as it can get. But I want to assure your viewers that if the situation gets out of control, we have measures in place that will assist us in that regard.
Let's welcome into the program the Honourable Premier of British Columbia, Mr. John Horgan. Premier Horgan, most welcome to the program. How are you doing?
I'm very well. It's great to be on the show today.
Yes, thank you for taking the time with us. COVID-19, big news. Lots of cases this week alone. And you had said that if necessary, in terms of an outbreak, prepare for 4 months. What does that really look like for residents of the Lower Mainland, that kind of preparation?
Well, first, I want your viewers and your readers to know that British Columbia has been leading the way in North America with respect to COVID-19. Back in January, when the first cases were being discovered in China, we put in place measures to ensure that we could contain any potential outbreak. As you know, British Columbia is a dynamic and diverse multicultural province. We are a small, open economy, but we have linkages to every corner of the world, and that's a strength. But it can also mean that we're inviting issues from around the world to come and visit our domestic population. So Minister Dix and Dr. Bonnie Henry, the Provincial Health Officer, have been working together to ensure that we're giving the public all the information they need. We have tested, as of today, 2,800 unique samples that cover about 2,000 people. But we want to make sure that the public has confidence that if there's a need to expand containment activity, if there's a need to look at economic consequences, that we're putting in place the tools that we need.
So are we in a position at that point to do a makeshift hospital situation because our hospitals are so busy as they are?
Well, we are at capacity, and certainly in the Lower Mainland, and we're always working on trying to ensure that we have space for those who need access to acute care. One of the things that, of course, we pioneered in Surrey was the establishment of an urgent primary care center. So rather than clogging emergency rooms, we have ill patients going to see a doctor, a nurse practitioner, or some other healthcare provider. So we're trying to separate out the acute care challenges with those regular illnesses or injuries that citizens may have in the course of their daily lives. But we're confident currently that we have the capacity within our acute care system and with the urgent primary care centers to separate out those specific cases. The majority are self-isolating. They're at home being visited by provincial health authorities rather than coming into a hospital, coming into a clinic, and potentially putting not just citizens at risk, but also healthcare providers. I've been working very closely with the Prime Minister and Deputy Prime Minister Chrystia Freeland. So we have a good coordinated response with Ottawa. For the public, it's not a jurisdictional question. The airports, the ports, borders are the federal government's responsibility, but that means nothing if you're concerned about your family and your well-being. So we're trying to break down those jurisdictional issues for the public so they can understand them. But I want to assure you and your viewers that we are not going to be deterred by who's responsible for what. We're going to try and find the best way to help citizens if they're ill, and also, of course, to help businesses get through what could be difficult times for them.
You mentioned earlier just a quick bit about the businesses. We do see a dip in revenue at YVR. It is certainly impacting the global economy as well. So what sort of measures are in place for revenue for BC?
Glad you asked the questions, because oftentimes people think, well, it's just a health issue. Quite the opposite. It's a significant health question, but it's going to have an impact on our economy. It's happening around the world right now. We are not immune to that. As I said, we're a dynamic, multicultural community. We look out to the world happily, gleefully. And the consequence of that is that the world has stopped moving, and that's going to have an impact on goods and services, on tourism. And so we're monitoring that closely, and we'll continue to update the public on our budget, as well as on any services that may be reduced because of the outbreak. The budget 2020 is another balanced budget. We built in a lot of prudence. Minister James has a large contingency fund and a forecast allowance, so we've got about $1 billion of wriggle room on the balance side. But we want to continue, of course, to provide services to people. Budgets aren't just about balancing, they're about distributing services to people. And we're confident that the budget is in good shape today, but I've established a committee of cabinet, which includes Harry Baines on the labor side, so that if businesses need to talk about employment standards, if we want to encourage people, if they're ill, to not go to work, that can have a negative impact on small businesses. It could have an impact on the workers as well. So we're looking at steps that Harry can take as Minister responsible for employment standards, how that would fit into our plan. Carol James is on the committee from a revenue perspective. Right. Lisa Baer for tourism, because that's the biggest challenge, is people are staying home. And that's going to have an impact on tourism revenues, which will have a knock-on to small businesses. Right. Also, Minister Farnworth, public safety, and Minister responsible for emergency management, BC. And lastly, of course, Michelle Mungal, who monitors and manages economic development. On the other side of that coin, of course, is the federal government. And I've been working with Prime Minister Trudeau and Minister Freeland. The Unemployment Insurance Act allows the federal government to perhaps accelerate dollars to people who can't get to work. So from a worker's perspective, we've got some contingency plans. On the business side, we're just going to have to take stock of what the impact is and manage that forward.
To watch Darpan's videos as to what's happening, what's new, what's trending, follow us on Facebook, Instagram, Twitter, and YouTube. Like, share, and subscribe.